Good morning and welcome to this meeting of the Safeguarding and SEND Subcommittee. My name is Kyla Perry, the committee clerk. I understand there is currently an issue with the YouTube live stream, so I am recording this meeting and it will be uploaded after the meeting. Okay, I'll now hand over to the chair. Thank you.
Thank you all and welcome. As everybody has just heard, 3 of us need to leave about 20 past 12. So Kerry will continue to chair if the meeting is still ongoing, but not to worry about not being quorum because there aren't any decisions and any important points can be fed back to us after the meeting. So thank you all. Apologies for absence.
Chair. Yes, so I have received apologies in advance from Social Solution.
And as Social Solution has just been elected as an alderman, that means we will have a vacancy on this committee. So, although technically I think today he is still a member until he's been presented to the Court of Aldermen, but we will go to the full court inviting people to put themselves forward for the vacant place. I think that will probably happen in April. So declarations of interest.
I have not received any declarations in advance. Thank you.
Thank you. So can we go on to the minutes then, rather than going through page by page? Can anybody just note any or indicate if there are any corrections or matters arising that we're not already discussing? No, see none. Can we approve the minutes? Thank you. Then we move on to the virtual school development plan. Debbie, you're online and I think we're going to present this to us. So over to you. Thank you.
That's great. The school development plan, it gives an overview of the work that's undertaken by the virtual school. And this one that's been submitted for committee, it contains all the work that took place in the autumn term. Since this was written, the restructure has taken place and a new contract begins on the 1st of March, transferring the virtual school from a term time only provision to an all year round service. Our children and young people need and have asked for support and help with their education during holiday times as well as during term times, because many children move during that time to different provisions, and so that will be secured for them from the 1st of March. There's been a temporary organised system until now, but it will all be in place by the 1st of March, which is good. There are 75 children today that the virtual school is supporting. Compared to last year, this was 85. And this is mainly due to the fact that the cohort of unaccompanied asylum seeking young people is smaller at the moment this year. Of course, this can change very, very quickly, and it could be completely different next week. But we just have to be prepared and ready for that. And the virtual school is. We have plans in place in case our numbers go up or down at any moment. And these numbers are made up of children who are in care or children who have a plan, such as a child in need plan, children who have a social worker and have had one in the past 6 years. Children who live in kinship care with grandparents or with their aunties or uncles, and children who are post looked after, so children who have secured permanence through adoption. We're very proud of the work that we've been doing recently with our children with a social worker ever 6, the children who did have a social worker in the past but no longer do. We've been supporting some of them with their GCSE preparation, their A-level preparation, their applications to university. We have a young person who's currently at Edinburgh University who got 3 A's at his A-levels, and we're supporting him. So we're very proud of that work. This term already we've got a young person who has received his diploma in City and Guilds in rail engineering. One of our young people has completed a coding course, another one in construction management. A number have secured their security licenses so that they can work at stadiums part-time while they study in London. 8 of our young people have recently signed up to the Trailblazers programme, which is being run by our Adult Education and Skills. And one of our young people has signed up to a Design, Engineering and Construction Award. We've got 11 young people who are attending dance lessons and 14 young people who are learning a musical instrument. So all is going well, and I'm very happy to take any questions from anybody.
Thanks very much, Debbie. Any questions from members, first of all? Steve?
Thanks, Chair. Thanks, Debbie. Yeah, perhaps you could just tell us how many of the, I think you called them 75 children, but I presume a number of these are young people who have left school. So I was interested about what the age balance is between those still at school and those beyond the age of 18. And then particularly those beyond the age of 18, I think somewhere else, and that maybe somebody else wants to answer this, but maybe you should. It says that there are 12 NEET care leavers. And so I just wonder what we are doing with those 12 young people to try to make them non-NEET. Thank you, Chair.
Yeah. First of all,
Just before
sorry.
Hang on, Debbie, just before you start, see if there's any other questions. We'll take a couple.
Okay.
No, okay. Well, I'll ask you the same question that I asked in call over, because I think what is really helpful, I guess, is to see the list of actions and the success criteria. But what I'm still not clear about is the impact that these actions have. And the actions are only as good as the positive impact that we have on the children or young people. So I think if you can explain more of that as well, would be very helpful. Don't see any others, so I think Anne, sorry.
Thank you. Just in relation to that, is there a figure of the cost per child of this service? Thank you.
Okay, Debbie, over to you now.
Okay, that's fine. So out of all those numbers, the majority of our young people are over 18. So we currently have 46 children who are over 18 that we support. Our NEET figures in September were 16, but they've recently, when we've checked our NEET figures recently, they've reduced to 9. So we currently have 9 NEET young people at the moment. They are our priority young people within our care leavers because they're not in education, employment or training. And we work with them very closely and with their social workers to encourage them back into education and to encourage them into work. We have 2 types of NEET young people. We have NEET young people who are in between courses. So some of those young people will have that they'll have finished one course, but they're not quite sure what to go on to next, and they haven't managed to secure any employment. So there's not only the virtual school who work with them, we also commission a service called Shore Trust, and we have a worker from Shore Trust who will meet regularly with those young people to put a plan in place to get them either into the job centre, to look at what's available there, to look online. We work very closely with ACES, which is our Adult Skills and Education Department, and they'll provide interim courses for them. And we can also provide online learning so that if they don't feel confident enough to go back into the workplace or go into a full-time college place, they can do some learning online. Many of our young people speak English as an additional language, and so many of them will have extra English lessons as well as the college work that they're doing. But there's lots of activity in that space, and those NEET figures aren't always the same young people. We do have a few young people who are what we call long-term NEET, where we're really working very closely with them. And that can be as well because they have got medical conditions that are causing them difficulties for getting into education and into work. But many of our young people, it's different young people at different times. I meet with Rachel and her team regularly. We have NEET meetings, catch-up meetings, and these children are monitored and their social workers write plans for them and meet them regularly to make sure that those young people are going to be back in education or work as soon as they possibly can. The cost per child, it depends on their age and it depends in which cohort they're in. We get the funding to pay for the staffing of the virtual school within our budgets. But then if a child is in statutory education, we get approximately £2,500 from the Department for Education. They call pupil premium funding. That will go to children between the ages of 4 and 16. We then get a lump sum of money for the 16 to 18 cohort, which is less than that and works out at about £1,000 per pupil. The care leavers, we get a post looked after grant for, so we get a £20,000 grant that we can spend in order to support all the young people. So it really depends on the age of the young people, but if members are interested, I could break that down for them and maybe produce that for the next report so that you can see clearly how much money we get for each cohort and age group.
Anne, I think you want to follow up on that?
Yeah, thanks, Debbie. That's about the funding. What I'm interested in is the actual cost of the service. If you were to work out an average per child, so the staffing costs, the administration costs, the contract with Shaw Trust, is there a way of working out how much this service actually costs per child? Because we've got 29 children between 0 and 18, so it'd be really good to find out, what the value for money is. Thank you.
Absolutely,
Chris,
I can get those figures for you.
Hang on, Debbie. Debbie, hang on a minute. I think Chris wants to come in on this one.
Sorry, Debbie, can
Absolutely.
I just come in on this one?
Yeah.
I was suspecting that was where you were going, Anna, with the question originally. I mean, we can go away and do that piece of work. It's bigger than the virtual school, though, would be what I would be saying here, in that if you take any young person, you'd have the costs of the accommodation, the provider, the social worker time, they're working with other services. So breaking down the cost per child in terms of provision that's provided by the City of London is quite. We'll talk to finance, but it's more than just a virtual school, is what I'm getting at, really. And we'd have to go away and do that piece of work, and it will change.
Well, I guess I kind of ask Anne where it is you want to get to on the cost question, because that'll help officers frame how they respond.
Yeah, I'm just really, because we've actually got quite a small number of children. We've got 46 who are over 18. We've got 29 children. So I'm really interested in the efficiencies of running a virtual school service for such as a small number of children, what the actual costs are.
So, one of the challenges for us, again, and it's about scale, is that within Debbie's cohort, there will be some young people, obviously we're in a public session, but that will cost, for example, in terms of their accommodation, their education, £3,000 or £4,000 a week. And then there'll be others. So averaging that out might not offer you necessarily a true reflection of.
Yeah. So to pursue this, I know about the accommodation and residential costs, those are extremely high. Everybody understands that. It's just the actual virtual school costs, whether or not that this is an efficient use of public money.
So is it what you're trying to get to? Is it the cost of the school services as opposed to all of the additional package of services that?
That's fine.
Yes, that's all I'm interested. The other I do understand.
That's absolutely fine. Thanks. Yeah.
Okay. Great. Thank you. Debbie, I think the other, perhaps we can come back to impact a bit later, because I don't think we've really gotten to the heart of that bit of the conversation yet. So leave Chris and you to perhaps have a conversation about how we get more into that, because I think, as I said, the list of actions is great, but unless we know they're working or effective, then it comes back to the efficiency question and value for money, I think.
Absolutely. And you'll see that definitely in the annual report that would be provided. Yeah. So that would clearly set out that, but we'll make sure that we'll draw your attention to that in the next annual report.
Thank you. The other point I wanted to make is that I don't know if all members of the safeguarding board have been to the celebration event, and I don't know if everybody gets invited, but actually I would strongly recommend an extension if not, because I've been to that event a few times now, and it is absolutely fantastic to see the pride from the children, which is a bit immeasurable in the value for money efficiency terms, but those kids who all have achieved something, and it's really fantastic to see that. It also gives us an opportunity to talk to some of the children. That's variably easy or difficult depending on the child, sometimes a bit like extracting teeth, trying to have a chat, but nevertheless it's still a great opportunity for us to see firsthand and to engage the children in their experiences, and of not just at virtual school but of all of the package of services that go around them in support. So if we could extend it to everybody, that would be good.
Would be great.
And
Yeah,
can you-
absolutely. That's fine.
Again, it's an information report. So unless we've got any other questions, we'll move on. Right, Town Clerk, then item 5.
Thank you, Chair. Yes, at item 5, we have the Children's Social Care and Family Help Service Development Plan. This is for information, page 29 of your agenda. Thank you.
Rachel, I think this is you.
It's me. First of two, actually, and they link together quite tightly. So this is the Children's Social Care and Family Help Service Development Plan, and it goes alongside the work of the families in the city, which is intrinsically linked. I separated it out to be clear. So as with Debbie's report, the Service Development Plan looks at where we've got to, what we're intended to achieve, what we have achieved, and what we're going to do next, based on what families have told us, what children have told us, what we've learned from research, what we learned from inspection, from audits, and looks about what we're going to do going forward. We've kept on the Ofsted recommendations from 2024, and I put in the two recommendations that we could contribute from the SEND inspection as well, to make sure we keep sight of those things and make sure we meet them and keep meeting them as well. Some of the key successes that we're incredibly proud of is ensuring that holiday activities are in place with the virtual school and our early help system to ensure that every child with a disability can attend, and we provide one-to-one support, whether that's our own staffing or whether we provide that through commissioned workers, which has not been the case for all children with disabilities in the past. That serves a number of purposes. One, it means we get to know the children and families really, really well, and we get to listen to the parents and the children. One of the challenges of having a small number of children is that the needs are really different, and you can't create groups for each type of need, if you like. So we have to be bespoke and responsive to that, and particularly where children have got additional needs, having the same familiar workers being there means that children are able to participate in dance and drama and all sorts in the holidays, which is great for them. Also great for their families to know that those children have somebody familiar to be with, so they feel safe in sending their children there. And that is something we're incredibly proud of. It also means that we can listen around what to do next and what to do more of for children in disabilities in particular. And that's particularly been really good at increasing the number of children who are Black from a global majority. In our holiday activity fund, over 90% of children are from Black or global majority families, and that's been really inclusive and something we've been driving hard for, to make sure that we include everybody, and it's shown by the fact that the places are all full, so we're very proud of that. You'll see it's quite a broad area of an offer, so I won't go through each bit. I'm just going to pull out a couple of highlights because it's incredibly broad work, going from preventing harm to responding to harm to responding to refugees, for example. And you'll have seen in the news today about the potentially, if you've seen the news today, in there is about the immigration changes and the impact for our young people. So we knew that that was going to be there. There are some exemptions for unaccompanied asylum seeking children, but it depends on their age. And so I've updated the care leaver offer in as simple language as I possibly can, which will be translated for all of our young people, but it does substantially change the experience for, and also for families who are subject to immigration control and the support we can offer. So I've been clear about that. And I'll be speaking with young people about that with Laura's children in care group, but also with over and over again in one-to-one social work with young people, so they know what to expect and they're supported through that honestly and legitimately, as well as families experiencing immigration control, because it will bring anxiety into the system. But there's a lot in it. It's an incredibly broad offer. It's something we're really proud of, trying to make sure that we're providing support to families before need turns to risk. And we started off this year with no children on a child protection plan, and I think that's as a result of the incredible amount of work that we do to meet need before it turns risk. So it's cost effective providing support early. What we all know, that makes sense. Support before things get entrenched or difficult. So we're incredibly proud of the fact that the city has enabled us to intervene early. But I'll happily to answer any questions. And it does link entirely to the families in the city board later.
Questions from anybody? Stephen, then Anne, and then Kerry.
Same one, Chair. No, obviously I think it says later on that we've got 33 young people who've got limited leave to remain. So I suppose that we as a subcommittee will be interested in the progress of what help you're giving those 33 young people. And just, I don't know, given the what's been in the news, you know, whether you could say something about how those people are feeling at the moment. And if there are any particular things that you think we need to be made aware of in respect of what might be happening in the next few months or couple of years with them.
Rachel, just before you go on, let's take all the questions and then we'll come back. Kerry. Oh, sorry, Anne, and then Kerry.
Yeah, thank you. My question's about something completely different. The children with disabilities, does that include all children, only those with an EHCP? And also I've got a question from a resident about access to activities. So if a family chooses not to apply for what's it called, direct payments, if they choose not to do that, then they are not entitled to access, for example, sports activities. So they have to pay for those activities. So in effect, they're discriminated against because they've decided not because of their income, not to make claims. They could, but they've decided not to use public money in that way. But they are disadvantaged then by having to pay, you know, quite considerable fees for sports activities.
Thank you. There's 2 items that are under amber, and I was just wondering if there's any updates on either of them, if that's all right, please. Thank you.
Can I just follow up on that? Because I was going to ask a similar question, Kerry. So yeah, there are 2 on amber and the rest are green. So I guess the question is, having got green, how do you push it further? You know, what are the next steps and how? Because I know the service, you're never complacent in these services, but there will always be something more that we can do that would be constructive.
All right, I've got them in order. I wrote them down because my brain is. So feeling how it feels, it doesn't feel very friendly. We are aware of that. I've had one young person in the past try to leave the UK because he found it so unfriendly because of immigration. But we try to, when there are particularly bad periods, and we've been in a particularly bad period, if you're not from this country and not necessarily feeling welcome with the rhetoric, we make sure that each young person, we acknowledge that. We say this is what's going on. It's not easy. This is not, but you will always receive a kind service from us and we will support you within that. I think some of the work that Laura does around the group work is really important because, and also with Debbie, the virtual school, group work is great because you can have shared conversations and shared experience, but whatever circumstance somebody's in, whether they're entitled to public funds or not, you will get a kind service. And even if we can say no, we will say no kindly and support through that. That's core for our work. We acknowledge it, we talk about it, and then we will also do whatever we can as parents, what you do for your own children in the circumstance. We'll also have the difficult conversations. So with pathway planning, which is where you look at what's happening next in the next 6 months, what's happening long term, you will always parallel plan. What will it be like if you're here in the UK? What will it be like if you have to return to the country? And then we also have this difficult conversation around what happens if you decide to not return and not have our services, which is basically go underground. We have a difficult legal position there. You're not allowed to encourage anybody. You don't want to encourage anybody, but you have a responsibility around the risks and safety. So, for example, I'm not here, but in a previous workplace, supported somebody who I knew was going to go underground. I couldn't facilitate that. But what I did know was prepare them to make sure that they had access to where the charities are, where the food banks are, where the health banks are, so that if they found themselves in a difficult situation because they had quite a serious medical condition, I'd have been remiss from helping that. So we plan carefully and kindly for all eventualities, and they've got emergency numbers, but mostly it's around all the stuff we do well, leisure, community, links in with voluntary sector, making sure people have got good quality legal advice when they need it in the right time, making sure, for example, we do data runs on when people's leave is to expire so that they don't do silly things like not notice their leave's expired, which happens to quite a lot of people across the country. So we do the due diligence that we need to, but it's not a nice environment to be in if, yeah, no, it isn't. But we but I'm trying to be, one of the things about being kind is being clear, that we're clear on what the immigration offer is and what we can do about it. Tricky. That was number one. CWD, whether it's all or the AHCPs, it's all children with disabilities. We know that not everybody with a disability has an EHCP. So we do engage people in the holiday activity funds. If anybody's open to my service, early help or social care or short breaks, everybody gets invited as well. And that's regardless of benefits. It's quite broad. We take a broad remit of that. Okay, so that is broad. Number two, I know the circumstance you're talking about, and I think you mean not direct payments, but disability living allowance. All right, disability living allowance. Yeah, so I know that. The reason is because of checking eligibility and needs change and disabilities change, which is why we use the DLA criteria. Otherwise, it would be very difficult for us to assess need from other people. Otherwise, there's no reason why you couldn't claim disability living allowance and then put it back into the pot. No, but I don't want to change. There's a really effective screening tool. And it's a very helpful way of us determining. Otherwise, we'd have to know every medical condition, every disability, and then assess need. It would become a bureaucratic nightmare. But people, we can, and if you are wanting to pay for things like sports and have it cheaper, that's what the DLA could be for. This is a state service, and that is a state service. So, it costs money in terms of our time and staff time to run the things. It's the same if you just got the disability living allowance. It would be really hard. But I'm happy to go away and provide a thorough response, which I have done, and I will do again. Yes, if that helps. But this is public money. The same. Yeah.
Just before we move on to the next point, can I just let people know that we are now live streaming?
Oh, okay. Cool, thank you. But disability living allowance is very useful and it really helps fund people who need it. And yeah. Amber updates, I'm now going to have to go back and check what those are. I'm so sorry. No. But I can answer number 4 whilst doing that. Yes. Number 4, when it's coming to the end of the development plan, it runs from April to March. What I do is look at, does anything else need to be carried forward? We should be getting to the point where nothing is amber anymore because we're getting to the end of the time. And I'll look at what's for the next plan, which you'll get next time for April going forward. Does anything need to be carried over? I will always carry over inspection findings, even if we've met them, to keep grip on it so that nothing dips. I think that's useful. And I will anything that's green that I think we need to keep a watch on, I'll include in the next one going forward. Anything we've completed will go, and then I'll do an entirely new refreshed one for the next sort of next year, based on all the findings from audits as well, and learning from the NEETs, which frustrated it. It always looks very frustrating having this same kind of number about NEETs, but it is different children. And some of the things we do with children is to do very lots of short-term courses. Teenagers sometimes, if they're not ready to do a year-long course, might do a week. Week might be achievable, and then you might have to wait another week to do another week. So we're quite flexible. And Amber, the first one. Oh, video interactive guidance. Yeah, that will go into 2026 going forward. That was one worker when the worker had the most work of anybody in the service at that particular point for early help, and it was too many things. I think it was too much. It's quite intensive, but we will do that. And there's one of the Amber. The send inspection. Fine, and I put in the send inspection that's just happened, so we haven't completed those things. We knew it was down to probably one family's experience, but one is still a family's experience, so we make sure that we're extra clear going forward so that we don't lose track of that. Is that okay? I think I've done 4.
Good, thank you.
Oh, 5. Okay, sorry.
Stuart, and then Anne has a follow-up.
Do you experience and how do you cope with language difficulties?
So we do experience language difficulties. The joy about my service is the staff are multilingual, so that is extraordinarily useful. So we've got Farsi, Dari, a range, Polish, and a whole range of different languages. So we have staff who do that, and second Spanish and all sorts, but we use interpreters where we need to. Often our young people will also use Google Translate. So sometimes for things they'll use Google Translate backwards and forwards. And now there's a rather delightful service, which we don't have yet, but with Google plugs, you can actually get things translated almost at the same time. It's pretty good. But even WhatsApping with young people sitting next to each other, you can WhatsApp. And we use telephone interpreters, so you can have your phone sitting with a speakerphone. You call a little number, and you just can have a 5-minute conversation. It's the Teams and telephone interpreting is phenomenal. It's always better to have it in person, but that's not good business now for interpreters. But I cannot tell you how great it is to have the WhatsApping. Yeah, and our young people do that all the time.
Okay, Rachel, move on to Kate. Anne, you had a follow-up, and then we'll move on.
Yeah, just going back to the children whose resident status is might be a problem for them. Do you do any work with City Police? I'm a visitor at Bishopsgate Police Station, and I'm very aware that when people are arrested for even what we might consider to be minor offences, they can be they're on their way to unfortunately being deported. So do you do any work with the City of London Police with this group of young people, just to tell them about, you know, what can happen even for minor offences?
Yeah, so we have quarterly scrutiny sessions with Laura to do that with the police. We've also looked at modern day slavery and trafficking around that with the police. I've done workshops with them, but mostly we speak to them every day, the police. And when they get new unaccompanied asylum seeking children, we're right there with interpreters and doing that. But in terms of under 18s, which is my remit, you wouldn't get a child deported ever. So it's not within my remit. It would be an adult. If there's any child that comes to notice, one of the joys of being small is we pick up the phone. So anybody under 18, they'll give us a call. For example, we have had this year a child who was arrested with some immigration issues that weren't refugee, and we were able to chat and talk and support and use interpreters and etc. But you'll never get a child under 18 deported ever. From a police station, they call us first and we'll deal with it and take the lead. So it'll be a welfare first response for under 18s.
Do the police do any direct work with this group of children?
Yes, but I can't do anything with more detail.
Okay, we're gonna move on now. Thank you very much indeed. So I think we're now on to item 6, 10 o'clock.
Thank you, Chair. Yes, at item 6, we have the Adult Social Care Service Development Plan. This is for information, page 45 of your agenda.
Ian, you're going to present this.
Yes, thank you. So the service development plan is broken down into drivers and areas of change and the intended outcomes of the actions and measures then relating to the outcomes. It's a live document. The actions are added in real time as they arise. So this version is at the end of January. It avoids duplication with the higher level strategy action plans. And also, although it tracks the more detailed audit action plans, the detail remains within the audit action plan. So you won't see that on here, but it will be tracked on here. The safeguarding is a theme throughout adult social care, but with particular reference to this group, there are specific actions on here for safeguarding. One is a review of the deprivation of liberty safeguards process and how we process them within adult social care. The other is a review of the escalation policy, should there need to be escalating any safeguarding issues or concerns. And also ensuring that the learning from the Safeguarding Adults reviews from the Safeguarding Adults Board is appropriately disseminated across relevant service areas rather than just adult social care in the city. There are 4 ambers currently. One is the finance project, which I can tell you has started as of today. So that one will be moving to green. Also, there are 2 related to the adult service user group. That's been struggling to sort of get people on board and get moving. Health Watch are running that, and there's a meeting on Friday to sort of look at that this week. And the final amber action is relating to use of AI in adult social care. We are looking to pilot a magic notes way of sort of working where you can record or you can translate an interview with somebody or a discussion with somebody and have it straight put into an assessment. Obviously, there's lots of kind of ethical considerations and legal considerations which need to slow that down, but it is something that we know is in use in other local authority areas. But that, in essence, is the plan. So I'm happy to take any questions you've got on that.
Thanks very much, Ian. Can I I'm sorry that because I'm looking at this in printed version, I can't tell. Various shades of grey don't really delineate which ones are the the amber ones, and I'm assuming the ambers in table 13 is equivalent to some issues being managed and 2 not started. Can you point to the 2 not started and of the issues being managed, if there are any obstacles that we need to know about? There was just a timing issue.
Yeah, the ones with the issues not managed are the ambers ones I've just
Right,
alluded
that
to.
is the amber,
Yeah,
yeah.
yeah, so they're the ones. With the 2 not started are the ones that have been more recently been added, which is the review of the escalation policy in adult social care, which is basically looking at some of the learning we've had out of recent coroner's inquiries, out of recent safeguarding reviews, and looking at how we can change or make sure that our escalation policy aligns with the Safeguarding Adults Board one, and just review it generally, make sure it's fit for purpose, which I think it is, but it's a question of being very clear on that and making sure that everybody understands it and understands when and how they can escalate. And the other one is the learning from Safeguarding Adults reviews, which I also mentioned at the end here. I think we've had lots of learning coming from Safeguarding Adults reviews that are Hackney Safeguarding Adult reviews. So rather than being city ones, it's about trying to look at those and think, how can we get that learning back into the city, and where would that appropriately be disseminated? Is it in our community safety partnership, it's in our rough sleeping services, or is it in the adult social care? So it's just trying to make sure that we've got the right process in place for doing that.
Thank you. Steve.
A couple of questions from me. I mean, firstly, and I've said this before here, that, you know, we are about to engage in a major housing programme on Golden Lane. And, you know, I'm just keen to make sure that your service is connected with the housing service, because we will need to move people into temporary accommodation while their flat is being refurbished. And just to know that we are identifying those people who might need support from your service. So that was one. And the other is, I think I'm surprised about the number of deprivation of liberty orders we seem to have in the city. So I wonder whether, I realise that we need to be careful what we say in public about that, but I just wonder whether at maybe the next meeting we should have a bit of a report about why we've got that number that we've got. Thank you, Chair.
In terms of the housing programme over at Golden Lane, we have the housing have come to the whole department and spoken to us about this at length and told us about the programme. We know it's going to be like a 10-year programme, and it's going to be a lot of engagement along the way, so we will be very much involved in that. Although at this stage it's very much waiting for that to develop, but yeah, definitely we'll be working with our colleagues in housing on that. Deprivation of liberty, happy to bring a report back specifically on that. That's fine.
Can I just follow up on the response to the housing programme? Because I think that the housing team have got a fairly robust timeline for that housing programme. So I hope that you've seen that, and I hope that you can be in a place where you know that you're going to need to be building services, you know, at the right time, as opposed to waiting till the moment and then think, oh, right, now what do we need to do? So it's being proactive, I guess. And by the nodding, and Chris, you look like you're about to tell me, yes, you are.
Yeah. So as Ian said, there's a couple of things. One is in terms of DLT, senior leadership level, we're across that. In terms of cascading the detail down into the service, that's about timing, and it would be a bit premature to kind of launch that right now into the depths of the service. But the director of housing, as Ian said, came to meet all of the staff about a month ago, just to kind of lay out the planning, etc. So I think what you'll see coming is more detailed reporting in terms of our planning and how we're going to implement that. So yeah, we are working across the 2 areas.
That's great. Thank you. Anne.
Thank you. I've got 2 questions. One I wasn't going to ask, but I'm going to ask it now about your involvement in Golden Lane about hoarding, because without going into cases, it is an issue everywhere. So 10 years will go very quickly, and there are residents who could do with help now around hoarding. And is there engagement? And is there what's the level of that engagement? My second question just is about the AI, I'm really interested in your views on this, because it's going to be commissioned next month, fully commissioning process and implemented. So you're going to start using this next month. Yeah, so, and I can see that you're working with a cross London group on local guidance. So what safeguards are you putting in place around? Because there has been some national press about social workers maybe misusing or not really understanding AI. Thank you.
I think that it probably won't be starting next month. I don't think we've got an actual start date as yet. But I think, yeah, you're absolutely right. There's some corporate guidance on AI, which we're looking at, and there's a lot of practice guidance on AI, ethical uses of AI, how you use it. That's across the sort of social work profession. And so, yeah, something with AI. I mean, obviously, we're engaged in data protection and governance and all that kind of thing. So everything's being looked at in a whole. But I think that's why we weren't necessarily an early adopter of this, because I thought it was good to learn from other authorities as well. In terms of hoarding, yes, it's something very much aware of. I mean, I chair this sort of hoarding, self-neglect and fire risk panel, and it's something that we have certainly considered in terms of the Golden Lane things. Absolutely, some of them are very, very difficult and take a lot of planning to work with service users and work with residents to sort of resolve issues in a state that they could actually move out of their house for the repairs. We are doing various things in that area. We do commission different services depending on the needs of the person with the hoarding issues. One of our more recent ones, which we're just getting over the line now, is commissioning what's called Fire Set. And these are ex-London Fire Brigade officers who have had specialist training, specialist work with what people who hoard, and can actually do fire risk assessments, property risk assessments, as well as engage with hoarding and engage with the therapeutic side of things as well. It's a complex area of work. There's complex legislation around how we resolve it. There's no easy wins for this. It's difficult and it's going to take time. But ultimately, there are legislation where you can do clearances when you need to. It's not always successful in terms of they go back very quickly and it can be damaging to people's mental health. So you have to be careful.
Okay, I'm going to move us on. Thank you very much, Ian. It's very helpful. So we're now on to item 7.
At item 7, we have the Adult Social Care Safeguarding Performance Report, Q1 to Q3, 2025-2026. This is for information, page 65 of your agenda pack.
And Andrew, I think you're going to present this, but just for members to note that the appendix is in non-public, so any points of detail will need to take in non-public. So it's just general comments at this point, please.
Yeah. So overall performance across the service has been meeting so the statutory requirements and local targets as well. Due to small numbers, there are large variations within the data set. But we have observed that the current conversion rate from concern to inquiry, it's from a previous peak, it's similar to previous years. It's now returned to that similar level. The overall rate of concerns received is still below the national average per 100,000 people averaged. We also looked at a bit more in detail, or we can see a bit more detail within our numbers. So the most reported categories of concern, we're seeing self-neglect being the most reported. Again, that's similar to national as well. And it's also the most category that frequently proceeded to an inquiry stage as well. In terms of the source of our referrals, where we're receiving that information from, the hospital is the most frequent referral source that we've observed. And that as well, we have further information on the risk of the source of the risk to the individual as well. But yeah, outside of that, those were the main headlines on our current adult social care safeguarding.
Thanks, Andrew. Any general comments, or do we want to move to? Okay, let's move straight on then to item 8, which is I think also an appendix, I think, in non-public.
Yes, so at item 8, we have the Children and Family Service performance. This is for information, page 69 of your agenda pack.
Andrew, is there anything you want to highlight in the general comments, or should we just move on?
Not in the general comments, no.
Okay, content to move on. Fine, then let's move to item 9.
At item 9, we have the Education and Early Years SEND Dashboard Performance Report. This is for information, page 77 of your pack.
And also we've got an appendix in non-public as well. So same thing, any general comments on this one?
General comments for that, it would just be overall, we are seeing currently seeing a similar number of open cases at the end of the quarter. However, the total number of cases that we've had come through has increased throughout the year in comparison to previous years. Also, the main EHC plan need category that we've observed with the data we have in place has shown to be autism spectrum disorder as the main category of need. But outside of that, that was the only real headline points.
Anne?
Thank you, Andrew. What's the waiting time for parents for assessments for ADHD and autism?
Waiting time on assessments, I'd probably have to refer over to service. We do observe and we do report on that there is statutory measures for the time taken. Last I saw, we are still working on our return for that. Last I saw of the data, they were pretty much all within these statutory timescales. I don't have an exact number at the moment, but all within.
Shall we move on then, Town Clerk, please?
Thank you. Next at item 10, we have the Families in the City update. This is for information, page 81 of your agenda pack. Thank you.
Rachel?
Yeah, and following call over, they set out 3 steps around the Families in the City programme, and I'll take it in three ways. So the first is the implementation going to plan? It is. We're meeting all of the Department for Education requirements and timelines. We report regularly. We have catch-ups with the DfE team to make sure we're on track, and we continue to work within our budget. And the Families in the City board continues to meet regularly to ensure partners are engaged across our partnership and have the opportunity to discuss and inform on the developments. The second stage is around family feedback we're getting. So you will see in the report that there is a quote from a parent. We do have permission to share that about our Best Start in Life provision. We're allowed to share that publicly. And after drafting this paper, we've run a range of consultation events. So we've run 2 open conversational sessions with parents and carers to gain further feedback on our Best Start in Life 0 to 5 offer. One was at the Barbican after a rhyme time session, and the other the afterstand following a stay and play. And we spoke to over 20 parents and carers, and the top themes emerged around the things that are going well. So there's positive feedback on the range of activities offered and at the range of different locations across the City of London, especially the libraries. People love the libraries. I love them. Positive experience with the Best Start in Life and library teams. Positive feedback on the children's spaces within the libraries. I think some of the work has been beautifully done, and we're doing some. I'm very excited to see the ball come in. We're doing more things to the libraries to make them look even better. Parents and carers shared what they'd like to see more of, and these included better signposting to services, making it clear who is eligible for what. For example, is it just for city residents or can anybody else come? And that's a thing across our boundaries. Yeah, so we'll be clearer on that. More activities in different languages, soft play options, safe playgrounds and sports activities are wanted, and more activities at the weekend for residents. And we've shared all the comments and feedback we've received with the Best Start in Life and Libraries team, and we'll use this to continue to develop our offer for families in the city. And we're planning further engagement sessions as we keep going. So we're always listening and learning and feeding back. Things we need to change, third step, the 3 that I mentioned. Just showing you it's going to be over shortly. We're focused on delivering new parenting and home learning programs, home learning being the basics that we all have seen in the press around children's readiness for school. You know, can you sit and read? Can you put on your own clothes? Can you talk and have a normal conversation? So it's now been professionalised to home learning environments, but it's strategic to make sure that children are school ready, really, and doing that as early as possible. We're considering plans to develop the Artisan Street Library and Community Centre as a key family hub delivery site. So it's beautifully done at the moment downstairs, but we're going to be looking at making the top bit more child friendly, and that will benefit the libraries to gain income through the usage as well, and will involve families in the design process. We can offer reassurance that there is an action in the Best Start local plan to map provision for the 0 to 5s, identify and address gaps. So it's an ongoing journey, and we'll develop that in the future. On the Families First partnership reforms, we're continuing to work with partners to look at how best to do that within our unique setup. One of the points of the Family First reforms is that families have a seamless experience with services, and we have that here very well already. I think we're looking at, so the SEND is embedded in the Best Start local plan. It's not separate to it. Children with disabilities are considered at all points as core children. We don't have a separate SEND thing. Everything needs to be accessible. The early years and library teams are exploring the possibility of SEND specific sessions, as that's an existing gap in services. And we're looking at expanding bumps and babies, and looking at the additional resources needed for that, because that is part of our service mapping at the moment. But it's a broad, Families in the City is a broad programme with all of our partners engaged in it, and there'll be new comms work making it clearer. So it's an umbrella of services, 0 to 25, in different locations, as well as some in person. More solid site at the Artisan Street Library, amongst others. It's quite ambitious, and it's broad, and it's on time and in budget.
Thanks.
I'm happy to take any questions, because it's a big piece. It's a big piece of work.
Rachel, the one question I had, because of the some of the negative comments we had when we were starting to talk about introducing this service and the range of services, there were I think that it's really important that we understand, as well as the positives, the negative feedback that we're getting and how we're addressing that. And secondly, I just wanted to say that, given some of the comments from the east of the city, particularly when people say we don't have services over here, whether it's correct or not, that's a statement that we regularly hear. So I'd be really keen to understand if you have any comments to say about the range of services at Artisan and how you're extending them, and the kind of feedback we're getting from that location as well, because I think it helps us when some members from that area saying we don't have enough.
Yeah, there's always more we can do, absolutely always more, and where there's good ideas, we'll listen to them and do. So at the Artisan at the moment, there's a whole range of 0 to 5 offer. They're looking at expanding their teenage offer in the library spaces, because they're realizing that that's an area that's underserved by that particular community. In the Artisan space, there will be in the future co-located services, including money management and advice, housing and advice, early help, including SEND and parenting strategies, a whole suite of work based in the Artisan. And it will be timetabled, because we don't have the volume to have people there all the time, 35 hours a week. But there is a full suite. There will be a full suite of activities in the Artisan there. There's also drop-in support for parents. That can be emotional support for children with SEND, or for parents. Parents in hard work. Parenting is hard work and relentless. And you can have support there, and signposting as well. But mostly you will have early help support that can be specific to your child, one-to-one or in small groups there at the moment. So it's a whole broad range, in a way that our early help offer is really broad. One worker, for example, can help you with benefits, can also help you with bedtimes and morning routines, can help you with a non-verbal child, can help you think about your child with ADHD, whether they've got a diagnosis or not. We've just finished running a parenting programme with a parent who's trained in supporting families with children with ADHD, diagnosis or not, to think about strategies and how you can parent effectively. And we'll be able to do that one-to-one as well. All of the social workers and early help workers are having refresher training in strengthening families, strengthening communities work, which is a group-based programme, but knowing that we probably can't run groups due to our numbers, it looks at child development year by year by year. for children with disabilities or not, and they can deliver that one-to-one as well, and one-to-one sessions, and that will be at the Artisan. So the Artisan is a focal point of the hub, but also workers will go into people's homes. So if there's a need to go into people's homes, we will. I'll talk about it all day. I'll stop now. Sorry.
No, I was thinking, and what about the negative impact? So you've given us a lot of information about Artisan, but
Yeah.
what kind of negative comments are we getting as well as the positives? And what, are they of a nature that this board needs to know about that? And
Yeah, there's always a wish for more send swimming. There's always wants for more send activities. And it would be really great to have a much better playground with soft play. That would be really great. More physical spaces for children to feel welcome in the city. There are lots of children in the city. There are visitors of children to the city, but you don't actually see and hear. My personal favourite is skateboarding in the city, but that's not popular with a range of other people, but I think it's great. But where you can see and hear children, so making accessible playgrounds, having soft play services, it would be lovely. So that's what I'd really like to see as well, as with parents. So if you're a visitor in the city, you can come and play in your green spaces, and children are welcome. And
can I just make a comment about the skateboarding and whether you've linked with the Blackfriars Underpass skateboarding development? Yeah, great, that's fine. Excellent, thank you. Any other questions or comments? No. Okay, can we move on then to item 11?
Yes, at item 11, we have the SEND City of London Local Area Inspection Outcome. For information, page 95 of your agenda.
I will be,
Hi, Sarah.
sorry, hi, in Kirsty's absence, I'll be presenting on that. So yeah, so it's an update report on our area SEND inspection, which took place in the autumn term. So it was a really positive outcome that we're all really, really proud of. We have now developed an action plan, which is now available on our SEND Local Offer website, which is in response to the inspection, and we'll be monitoring that through our programme board. But yeah, any comments or questions really on your report?
Thank you. Anne.
Yeah, congratulations on the report. It's really good. I'm going to go back to the ADHD assessment waiting times, because I've been told that they're within statutory guidelines, but the report, I mean, there's hardly anything negative in the report, but they do mention that there's some waiting times for diagnosis remain long, and families are offered support from the voluntary sector. So could you just say a bit more about that, what the actual state is?
Yeah. I mean, City and Hackney, so in terms of the health waiting times for neurodevelopmental assessments, I mean, there's a lot of work being done to bring them waiting times down. I don't know off the top of my head specifically what the waiting times are for the different age group, but I do know that they've put a lot of investment into how they can kind of bring them waiting times down, and children that are waiting for assessment, looking at what can be done to support those children while they're waiting. So yeah, I don't specifically know what the timescales are off the top of my head, but I do know that there is a plan, and there is a lot of work going on to try and bring them down as best as possible. But I do know that they're comparatively, I think they're okay.
Could you possibly provide that information about what the average waiting time for an ADHD assessment is? Because I know nationally it's not great. So if you could just say what it is in City and Hackney, that'd be great. Thank you.
Yeah, I'll have to take that away, because I don't know what that is, but I can take that away.
Sarah, could you also just, give us some information, because it varies according to provider, doesn't it, and right to choose. So I don't know if we help parents look at right to choose and help support them to a particular place, but the range is really quite significant from one provider to another. So if you could add some of that in as well, and what action we take to help people get to a place that we know is you're comfortable with the competency of the assessment, and if it's a shorter waiting time, how we direct people or help people choose.
Yeah. I mean, I think that's something I'll take away, because it's not something I know, but I can definitely take that away and bring an update on that.
Good. Thank you. Rachel?
Just to say that through the Family Hub, we offer parents support whether children have got a diagnosis or not. So strategies at home. So nobody's waiting for a diagnosis to access any support, much like the ADHD parenting programme, but also individual work for families. And if we have a family open to us and we think there's more to be done in school, we will push for that as well. So they don't get left. So we do advocate strongly.
Chris?
I wonder if perhaps maybe we can go away and talk to colleagues in health and perhaps invite them to come here, specifically speak about that area at one point of the forward plan.
I think that would be very helpful, actually, so, and give us a kind of a, quite a broad range of information, because it's not just about the ADHD, is it? It's the association.
Yeah.
With other things as well.
Okay.
Great, thank you. That would be really helpful.
Yeah, no problem.
Okay, then can we move on to item 12? Sorry, I should just say fantastic result on the SEND inspection as well. That was really brilliant, and I think we should have that noted specifically. Thanks.
Next at item 12, we have the City of London Children's Services Practice and Impact Review Summary, 8-hour scrutiny, March to November 2025. For information, page 109 of your pack.
And again, we've got the appendix in non-public, so if we could just have general comment at this point, and then we'll move into non.
Yeah, absolutely. So as Steve said, this is the 8-hour scrutiny report, which covers our quality assurance activity from March to November 2025. I think the report evidences the strong quality assurance processes that we've got in place within children's services with our regularly monthly practice reviews, which are a fully embedded part of the framework. The feedback from practice reviews is consistently high, with all the reviews in this period being graded as either good or outstanding. The reviews incorporate the feedback of the allocated worker, the line manager, and most importantly, the child, young person or family where possible. So this really helps us to triangulate the information and give a clear sense of impact, outcomes and experience for our children and young people. We've got a clear and consistent moderation process in place, which involves the independent reviewer, director of people, head of children's social care and early help, and the head of safeguarding and quality assurance. So we utilise this moderation process to consider what more could be done to improve and develop the services even further, even when the practice and outcomes are graded as good or outstanding. Where can we continue to build on this? So the recommendations from the practice review are all tracked on a monthly basis to ensure that they're progressing and to monitor the impact of this and ensuring the service continues to develop to meet the needs of children and young people and their families. So happy to take any questions now or any in the non-public section.
Any questions for public? No. Okay, then we will move on. Thank you.
Thank you. Next at item 13, we have questions of matters relating to the work of the subcommittee. I have not received any questions in advance.
Okay, then we'll move on to item 14.
Thank you. Item 14 is any other business the chairman considers urgent. Thank you.
I'm not aware of any, so we'll move on to 15.
Thank you. Next, we have exclusion of the public. Does the committee agree to exclude the public for the remaining items of business? Thank you. Please wait a moment while I end the live stream. Thank you.